Hello everyone and welcome to another edition of For the Health of It. I'm Lou Beccaria and thanks for tuning us in. It's always a pleasure to have you with us. Well, today we have the pleasure of doing a show on the renowned Moore Eye Institute that's now connected with the Phoenixville Hospital. And with us to talk about the Moore Eye Institute are Dr. Leonard Ginsburg, who is the Chief of Ophthalmology at the Phoenixville Hospital and Moore Eye Institute here, and Dr. Cynthia Ali, who is involved with pediatric ophthalmology and strabismus surgery. Did I get that right?
Yes.
Okay,
correct.
good. So as we kick off the show, why don't you each tell us about your background? Dr. Ali, let's start with you.
Well, I went to medical school at Temple University, and I did my residency in ophthalmology there, and then I decided to specialize. I really enjoyed working with children, and I wanted to continue on with that path for my career, so I did a fellowship in pediatric ophthalmology in Washington, D.C. Mm-hmm. And I was working full-time at Temple University Hospital as an attending physician and the residency program director. And then I joined Dr. Ginsburg, at his Springfield location of Moore Eye Institute, mm-hmm. because we really had very similar philosophies of patient care. That's how we
good. Sounds like a great
here.
Background to come to us with. Dr. Ginsburg, how about you?
I grew up in the area. I was honored to have a grandfather who was a family physician and delivered 4,000 babies in South Philly. So I wanted to be an obstetrician. And my grandmother was going blind from macular degeneration. And my grandfather was losing his vision from diabetes. And so when I was doing that, I knew I wanted to be a doctor, and my grandfather went up to the Joslin Diabetes Center up at Harvard University. And my grandmother, no one could help her. She went from Philadelphia to Florida, and she lost her vision mostly from macular degeneration, and they were giving up on her. And so I took her up to Harvard as well, and I met a vision rehabilitation specialist who spent hours with her. And the hardest thing for my grandmother was not seeing her grandchildren's face, and doctors didn't get that. They said, well, you still can see well enough to walk around, I mean, what's the problem? I mean, you're okay. And yet she was tortured that she could not recognize her grandchild. Yeah. And when she went up to Boston and she was able to suddenly be able to start recognizing her grandchildren with the proper rehabilitation, I said, wow, I think I want to be a retina doctor. Mm-hmm. And my grandfather was treated up at Joslin for diabetes. So I went to University of Pennsylvania College and med school, and I'm greatly honored. My grandfather has the Ideal Physician Award named after him, the Dr. Morris Ginsburg Prize. And so I had that kind of as a role model. So to finish off, my life pursuit was to kind of go where my grandparents were helped. Mm-hmm. And so I went to train at Harvard and the Joslin Diabetes Center. And so instead of being an obstetrician, I ended up being a specialist in macular degeneration and diabetic eye disease.
Wow.
And I was thinking of staying in Boston forever, but I had parents who had other ideas. And they said, you got to come back to Philly. And Crozier Keystone Health System and others, Mercy had recruited me to come back from Boston to open an eye institute with a condition that if it would be the best technological institute back then anywhere, I'd leave Boston and come back. And actually the reason I'm now at Phoenixville is Phoenixville Hospital approached us and said, basically, the area is so wonderful. We've got this great hospital. We just spent over $100 million advancing the cause with great technology. Would you like to come? And I said, no, I'm kind of busy already. And they said, but in the entire area, there's really no subspecialists. There's not retina specialists. There's not glaucoma specialists. There's not pediatric eye care ophthalmologists that do surgery. There isn't a glaucoma oculoplastic surgeon, and our group has all of that. Mm-hmm. And I said, well, this is quite an opportunity to service a community. And then I looked at community health systems, and Phoenixville Hospital in particular, and they pride themselves on community service. And they have 700 educational programs a year, which is awe-inspiring. To me, it's all about education. It's about community service. It's about patients working as partners in their own care. Mm-hmm. And so I said, yeah, the hospital got the best equipment anywhere. It's just extraordinary what they did. They really meant it when they said, we're going to get this to be the best technological center anywhere so that our community doesn't have to travel an hour away.
Well, tell us a little bit about the Moore Eye Institute. How long has it been around, and why is it so renowned? And that's the way people refer to it, as the renowned Moore Eye Institute. So whichever one of you would like to take that.
I guess I'll take it. We're going into our 20th anniversary. And I guess what's made the difference is most eye doctors, ophthalmologists are leaving healthcare. They're leaving the hospitals. They're opening up their own surgery centers, and they're not really parts of hospital. And I want to see something very different. I believe that we have to put eye care back into healthcare. The eyes are the windows of the soul, but they're the windows to the body. If you ask any physician, the first thing they've ever learned was the direct ophthalmoscope to how to look at someone's eye, where you can look at diabetes or hypertension right in the blood vessels of the eye. And so if I get to work with my nephrologists, the endocrinologists, the cardiologists, you need a team approach. We're becoming way too specialized in medicine, and now people barely ever talk to each other, and they're away from the hospital, and you're lucky to meet together. And our whole approach with MORE is to bring a teamwork together of all the specialists working together for the sake of the patient. And the patient has to be a partner in care.
Yeah.
You do that with the finest technology, and I think 2 of the 3 most important diagnostic tests in medicine now for retina, in OCT and ICG, I was honored to be the 3rd in the world to do ICG for macular degeneration.
Wow.
And yeah, it's kind of nice. My grandpa would be proud. And OCT, the optic coherent tomography unit, it's the most important diagnostic test in all of ophthalmology in America, and MORE Eye was the first to introduce that in 1997 in the state of Pennsylvania. So we do a lot of technology. We have some really great specialists. We don't look at a cataract, for instance, as just a cataract and anyone can do it.
Right.
We have a glaucoma specialist who does cataract surgery, or a macular degeneration specialist who does cataracts. Everyone's unique.
Is that what you've just described, is that what kind of sets you apart from, say, Wills Eye Hospital? You know, everybody knows Wills Eye Hospital, but are you complementary to each other, competitors of each other? Is there differences in their philosophy about dealing with eye care?
Oh, I hope that there's so many patients out there, 5.5 million patients, and we are the great eye institute in the community. We're not in Center City. We're in Phoenixville Hospital, we're at Abington Memorial Hospital, we're in Chester County and Springfield Hospital, Crozier Keystone Health System, and we are hospital affiliated. We have the same technology as some of the wonderful other institutes you've mentioned. We have specialists that specialize in all the care, but we're right there in the community giving great care.
Well, let's turn our attention to you, Dr. Alley.
Okay.
Tell us about the pediatric ophthalmology aspect of the institute.
We're really excited to be able to offer pediatrics here, especially at Phoenixville Hospital, because it's a subspecialty that prior to this hasn't been offered in the community. So if a child had an eye problem, it's scary enough, but now the family's being faced with traveling to Center City to have the problem addressed, maybe going to an unfamiliar community, and the child going to unfamiliar surroundings. And if an emergency develops, now they're having to travel to have it addressed. And now we're able to offer this service right in the community. So, I treat all aspects of childhood eye problems and eye diseases, both medical and surgical.
How do childhood eye issues differ from adult eye issues? I mean, is it the fact that the children's eyes are still kind of maturing, growing? And does that create different problems?
Absolutely. A lot of it has to do with the vision is developing, the eyes themselves are maturing, the brain is developing, and there's certain congenital conditions that are being treated and addressed in a child which aren't an issue anymore in adulthood. And then the main diseases that affect adults don't affect children, things like macular degeneration, diabetic retinopathy, not very common in children. So it is really a whole different host of diseases that you're dealing with. And the patient population itself is dealt with very differently than an adult patient population.
In what way?
Well, a lot of times you're dealing with patients that can't communicate with you, that can't tell you their symptoms, can't describe their symptoms, or you can't check a vision by asking them what they see. So it's a
bigger
different
puzzle.
It's a bigger puzzle, can be a bigger puzzle, and the exam has to be approached differently, and the patient's approached differently. So it is really a kind of a separate field in a way.
Seems like a whole lot more interpersonal challenge than, say, with adults, from the way you're describing it.
I think so. It's a challenge that I've always loved, but certainly not a challenge that everybody wants to take on.
Takes a special quality,
So.
and she has it, the caring spirit.
One of the things I would like to ask you, because I think it would really benefit the people who are watching, and that is, how can we as the average person take good care of our eyes?
Things like not smoking, very, very important. Protection from a lot of UV exposure. So when you're outside a lot in the summer, sunglasses are a good idea. Definitely seeking professional help whenever you notice a change in your vision, you see floaters in your vision, or any changes in your vision.
Dr. Ginsburg, I understand that you have kind of an extra specialty in diabetes. Could you tell us about that? And I know that that's pretty close to your heart about dealing with diabetic conditions.
Patients with diabetes sometimes either don't know they have it or they're in denial. They want to think they can do just about anything. If you can motivate a patient to start taking care of themselves, it really makes a difference. Going blind is the #1 fear in America, and diabetes and loss of vision is the #1 cause of loss of vision is diabetes in America under 65. So if I can partner with the nephrologists and the endocrinologists to work at trying to control blood sugar, you can reduce complications by 73%. So I'm the actually only certified diabetes educator in, I believe, the state of Pennsylvania that's an ophthalmologist. So I kind of, after getting my medical degree, got that extra degree so that I could teach how to take care of your diabetes as well as treating with laser or surgery diabetic eye disease.
Yeah. Well, maybe you could do a little bit of teaching here for all of us.
Sure.
What is it about diabetes and the high sugar level that does the destruction of the eye?
So what happens, it's similar to the rest of the body. The body is, if you're 98.6 degrees, you do well. If you're 106, you don't live. If you go down to 94 degrees temperature, you don't live. God has created a perfect working body, and it has to be in a balance. So your blood sugar has to be at certain levels. Diabetes patients lack either insulin or are resistant to insulin, something that the pancreas makes. And this makes blood sugar after they eat to go very high. So instead of being, let's say, between a normal of 80 and 120, they might go to 200 or 300. Wow. Well, the body has pipes throughout it. That's what blood vessels are. It's just pipes or arteries and veins. Pipes rust if they don't carry water. They're meant to carry water. If they're in Alaska, they're meant to carry oil. Well, in the body, they're meant to carry blood sugar at a very specific level.
I see.
Over years, blood sugars that are going up and down damage periocytes, which are one of the 2 cells that make up a pipe or the blood vessel, and they start to drop out. And as a result, the pipes of the body start to leak, and then you add on atherosclerosis or hypertension, and so you get clogging of blood vessels, you get leaking of blood vessels, and so in the eye itself, these blood vessels, which feed the film, the retina, you only get 1 roll for life, can start to leak. That's called diabetic macular edema. Or they can start to bleed. That's called proliferative diabetic retinopathy. My professor at Harvard was the one who invented the laser treatment for that. And so it's a very important thing that you're monitored because often there's no symptoms with diabetic eye disease. The same can be said for nephrology, the same with foot disease if you're not looking at your feet adequately, because sometimes you're not seeing as well or you're not feeling the bottom of your feet. You have to examine them or you'll get a foot ulcer.
Yeah, that's why they call it the secret killer.
That's right. It's an epidemic. Yeah. 1 in 5 Americans will eventually develop diabetes.